Hello, I'm Dr. Kara Michelson, and I'm here today to chat with you about the much needed course in how to take blood pressure. You might think this course is for healthcare students or workers, but is actually for the everyday person. Why, you ask? Well, that's a good question. And one answer is COVID-19. When COVID-19 hit, the world changed. Overnight, people were not allowed to go outside their houses or even touch their loved ones. One of the biggest impacts was on the healthcare industry. People could no longer or didn't want to go to doctor's office. And if they did, it was hard to find somebody who would see them. So, nearly half American adults in the US have hypertension, and only 1 in 4 of those adults, so 24%, with hypertension have it under control. And heart disease, before COVID-19 hit, is the leading cause of death in the US for men and women. So that means one person dies every 37 seconds each day. These people need to see doctors on a regular basis to monitor their blood health or to catch the disease before it becomes emergent. With COVID-19 protocols, people are not being able to see their healthcare providers, or they don't want to. You can chat with a doctor over the phone, but one of the most important tests in cardiovascular disease is checking blood pressure, which you can't do with a doctor over the phone. So how do we monitor these patients, or have these patients monitor themselves? How do we prevent these people from coming to the emergency room or controlling their disease before they need to go to the emergency room, or even see a doctor for that matter? The answer is teaching them or their loved ones to monitor their blood pressure. So this course is designed to help teach people not only how to take blood pressure, but why and understand what the numbers mean. This is a course designed to give people who have no medical background or little to no understanding of the human body. The ideal participant would be anybody currently taking hypertension medication, anybody with a family history of cardiovascular issues, caregivers, or people who became caregivers during COVID-19. Anyone over the age of 40, because we should be monitoring our blood pressure every year. Of course, with how much anxiety and stress that's going around, maybe we should be monitoring that every other day. Anybody that has a family history or current issues with cardiovascular disease, and anybody that has kidney issues. So our terminal objective for this course is to get regular people to know and understand how to take blood pressure at home. This will be assessed in a few different ways. To make sure people get the basic knowledge and steps of blood pressure, there will be multiple choice exams spread throughout the course for them to practice their knowledge. Second, there will be a short essay that students will write about the importance of blood pressure that will be put in their own words. This will make sure that they have a comprehension of the topic at hand. Last but not least, there will be a video recording that participants will upload of them taking someone else's blood pressure or their own, which will be monitored by an instructor. Our objectives for this course, so what the student should be taking away by the end, is to be able to recall the normal and abnormal ranges of blood pressure, summarize the importance of blood pressure, and to demonstrate how to properly take someone's blood pressure. This will be an interactive course. There'll be multiple ways of learning. One will be animated videos showing the students different ways of taking blood pressure, automated and manual. There'll be worksheets to help get students to understand the cardiovascular system and the ranges of blood pressure. There'll be multiple choice flashcards and drag and drop places for students to assess their knowledge and to practice their skills. There will also be audio clips so students can listen in their car or while they're exercising. And last but not least, there'll be interactive videos so the students can practice and understand what different equipment is of the blood pressure, but also of the cardiovascular system. In this new world where doctors' offices are not available as they used to be, and stress and anxiety in this country is increasing, it is important that people have a tool to help themselves or their loved ones in this crisis. This class will help people get a better handle on their lives and allow them to get a better handle on their health issues. So maybe they don't have to visit the ER and they can help prevent cardiovascular issues. This course is also short and simple that anybody on any level of education can understand it. There's a minimal facilitation needed to run this course as well. So thank you for your time today, and thank all the doctors out there who are helping their patients as they can. This is just another step into preventing cardiovascular disease in this country from killing people.